Hello all. On the eve of International Yoga Day, I welcome everybody for a session on yoga in pregnancy. So, yoga is one of the great ways to stay active and healthy. Because pregnant women need to be both ways, active and also healthy, we definitely recommend yoga all throughout pregnancy. So, what are the benefits of yoga is one thing that we can discuss today. How the advantages can be carried over in pregnancy and how to take forward the same yoga even during pregnancy and postnatally for a healthy lifestyle. So, what are the advantages of yoga? For that matter, any exercise during pregnancy improves blood flow, improves oxygenation to the muscles, and yoga especially is known to improve oxygenation via the breathing exercises and also lot of muscle relaxation via the stretching and the yoga poses. So both ways we have got advantages of not only relaxing the muscles, the sore muscles especially, and also giving strength to the back, especially the spine, because there is an angulation of the spine that changes in pregnancy due to the abdominal girth which outs in the front. So there is an angulation problem, and yoga not only strengthens the muscles, it also helps in back strengthening exercises. So not only this, it also improves blood circulation, the much needed oxygen supply, and also develops the lung function, which is slightly compromised when it comes in the last trimester because of the heavy abdomen. So yoga, once you start practicing, you will definitely know the advantages as it moves forward during pregnancy. So it is also known for other than the muscular strength, relaxation properties, oxygenation that it gives into the body. It is also a great stress reliever. It completely relaxes your body in such a way that there is a lot of effect of calmness that comes into the body. Especially in pregnancy, women go through lot and lot of emotional changes, lot of physical stress and strain, lot of responsibilities, anxieties, tensions, and all these things. Yoga, in fact, deals with all these things and calms you, not only physically, it also gives a very calming effect mentally. There is a lot of effect of de-stress that happens to your body when you go through yoga. The stress that you get relief from not only eases your bodily systems, it also eases your mental well-being and peace settling into your body. So yoga as such is just not about some exercises, it's just not about some physical training. It is also a balance that gives into your emotional well-being. You all must be knowing the definite definition of health. Health is just not the absence of a physical deformity. It is also about physical, mental, emotional, psychological, and social well-being of a person. Yoga helps in all these attributes. It also corrects you emotionally. It also corrects the social part. When you practice yoga, when you have group yoga sessions, but especially for pregnant women, when you have group yoga sessions, there is a lot more of yoga than other things. Other things are also happening. Like you bond with like-minded mothers, you talk to them, you have a healthy discussion. Everything goes in front of your eyes. There's so much positive energy that is there. And socially also it gives you the comfort feeling because whoever is going through this phenomenon, they usually end up having normal vaginal deliveries, and that gives a retrospective boost to women who have just enrolled. So it is also about social and emotional well-being. Never think a state of well-being or health is just about physical health. It is always physical, mental, emotional, psychological, and social well-being. That is the perfect definition of health. And when it comes to pregnant women, yes, there is a lot more of things happening inside the body other than the pregnancy. Under the influence of pregnancy hormones, there is a place of various systemic problems that pregnant women face, especially in the first trimester, a lot of nausea, vomiting, headaches, sometimes muscle cramps, lack of sleep, uh, acid reflux. There are so many other various changes in the body that happen, especially even in the circulatory system. They get tachycardias, they get palpitations. All these things generally usually respond to small exercises and yoga, especially in the first trimester. We usually advise them about pranayama, about the breathing exercises which come as a part of Ashram pranayama, the Anulom, the Brahmari pranayama. All these things are very much safe. Not only does it improve the oxygenation to the new pregnant mother, also it improves blood supply to the pregnancy itself. The oxygen carrying capacity also increases, and the unnecessary carbon dioxide is also out. So the moment the pregnant women start practicing the minimal exercises, along with walking 15 minutes morning and evening or 20 minutes morning and evening, we usually suggest them to start off with pranayama and allied yoga along with the minimalistic, the entrance of the walking and sitting down and calming and meditation and all these things. These remove the unnecessary apprehensions that go in the pregnant woman's mind. Technically, we start off the early pregnancy yoga and the usual yoga, that is the hardcore yoga of pregnancy, from the second trimester. Once the NT scan is done, we enroll them into proper yoga classes, especially when we categorically know what kind of a outcome is expected out of the NT scan. Yes, if the NT scan says that the outcome can be little risky in terms of extra risk of preeclampsia or a smaller baby risk or hypertension or any other risk that is needed, we put them into a category of little high risk and give them uh, intensive coaching or whatever you call intensive program for yoga. All the normal reports of NT, they go into the normal schedule of yoga. Any high risk NTs, that if the placenta is completely covering yours, or any history of twins, or if there is any bleeding episodes or previous preterms, they go into the other category where we are very sure that we give them very safe exercises only. Usually we don't give them much strenuous form of exercises. So it is the pranayama and the minimalistic exercises that go for these category of people. And once the NT scan is done, we start enrolling them into yoga sessions, which are usually one-on-one, like the pregnant woman and the tutor in a session weekly once, and then they practice these things at home. There are twice a week and twice a week sessions also, depending on the requirement of the pregnant woman and their physical comfort for a for a physical session. In view of COVID, we have taken yoga sessions online, and there are regular online yoga sessions for a group of pregnant women who can talk to the yoga instructor one on one. So when it comes to yoga, it has an immense role in healing of the body also. We have observed that with yoga, even the high risk pregnancies, there are the categories like hypertension pregnancy, the low birth weight baby tendency. All these things have also fared very, very well. We have had very good results with people with anxiety and people with a lot of disturbances in their thought process and think and their way of behavior in terms of over anxious behavior. So all these people also yoga had very, very good effect also on pregnancy. When introduced early, the muscular system benefits much more than anything else. There is a lot of relaxation. There are no unwanted aches and pains in the body and joints, and there is no unwanted water retention that happens. Especially the spine is very well trained and you do not have low back aches. When we do regular yoga, in pregnancy, prenatal yoga sessions. So all these things are pretty much very well controlled. Not only that, we have had enhanced benefits like improved fitness levels. Also, they have a lot of energy to do and the daily course in their daily life. They do it very efficiently. It has also improved their functioning level in terms of delivering their everyday duties and course as a part and parcel of the family and also at their workplace. So, if a session is done every day in the morning for them, the entire day goes very smooth. And even at the end of the day, the aches and joint pains and sleeplessness and discomfort levels are also very, very less. So, when it comes to yoga, we have seen this pattern for the past couple of years. We've been doing yoga and pregnancy and yoga and postnatal exercises and all in our setup, and we've had very good results in achieving the normal delivery weights. Yes, whoever has done yoga with us in our setup uh, with our instructor and one to one. If there is any small issue, we have one-on-one sessions on a regular basis, which is all free of cost. Because to have a target that a normal vaginal birth is superior to anything in terms of health of a mother, we go with our vision concentrating on that part. So when we concentrate and we have a vision and we have a purpose of inculcating yoga into our pregnant women's calendar and life on a day-to-day basis, on a routine basis, our outcomes are also that very good. When we talk about outcomes, those who have enrolled in yoga, definitely most of them, I can even tell that 95% of them have had normal vaginal deliveries. And we had a very drastic fall of all complications that happen during pregnancy, like preeclampsia, that is in pregnancy, or preterm deliveries in pregnancy, or you have to talk about smaller baby risk. All these things have reduced so much that a normal vaginal delivery is a definitive outcome of yoga in pregnancy is directly proportional to what I'm because we have seen that kind of correlation. And when we have to talk about the association of yoga and the association of pregnant women's confidence all throughout pregnancy, it is definitely much better. They are very well aware of their bodily changes, they accept the bodily changes, they are in sync with what is happening with them, and more friendly in terms of giving that body comfort that the body wants, and also they enjoy the classes as a part and parcel of a prenatal activity program. Similarly, post-delivery also we have a postnatal activity program wherein mother and child together we have yoga sessions and activities so that even postnatally this yoga culture goes forward in giving her entire comfort at her home ground level and easily coping up after the delivery with the child at the home environment. So it is very important that anybody who is even planning pregnancy to inculcate yoga into their schedule, improve their bodily function and strength, go through the yoga program all throughout the pregnancy and continue it after the delivery also. So when somebody who has a yoga program prior to pregnancy, when they come for their fertility issues and all, we inculcate the Surya Namaskars, we inculcate some yoga courses which improve the blood supply to the gonads, improve the blood supply, improve fertility levels, and from there begins their period of preconception, conception, and postnatal, all throughout pregnancy and childcare, so that they are comforted in terms of their physical strength and also emotional strength. Vitamins have a role in pregnancy that is known to everyone. In a similar fashion, yoga also has a role in pregnancy as water as well. I always tell my patients that whenever you are contemplating management of pregnancy or pre-pregnancy or infertility or postnatally, you have 30% medications working and giving you benefit, 30% yoga and exercises that give you benefit, and 30% is your diet that gives you benefit, and 10% is your luck and environmental influences. So definitely, it is very, very important in these days of a lot of stress and strain that women go through at the home front and office space and multiple challenging roles, that they should have their me time in the form of yoga and exercises to improve pregnancy outcomes. So, as a part and parcel of that antenatal care, we have enforced yoga in such a way that it is more than beneficial for pregnant women and their delivery outcomes. When we have to talk about physical strength, as I have told you, it improves the bone strength, it improves the calcium absorption, it improves the posture, it improves tone of the muscles, it improves endurance, it improves the efficiency of normal delivery and strength during contractions. So, with all these things, efficiently the labor interval is shorter, the deliveries are faster and more predictable, and also we have seen lesser chances of complications like postpartum hemorrhage and emergency deliveries like meconial deliveries and any heartbeat variations that happen with the babies and all that. So all these things happen very good. Yoga helps in not only physical strength, it also helps in endurance. When you are in your prenatal classes, especially yoga classes, they also have been taught about Lama's childbirth education, wherein they know what is happening during labor, and the couple has definite role in supporting each other in terms of when the woman is doing exercises, how the partner has to support her to give her specific poses of yoga to strengthen the pelvic floor, back, and the leg muscles. So it is the partner yoga that we have formulated in such a way that even it is about the couple being pregnant as a concept and how the man of the house can help the woman, help her during her pregnancy and childbirth. In a similar way, the Lamas classes along with yoga sessions have this benefit of teaching the father to be how to support during labor, how to support and how to take things forward when the woman is going through a lot of pain and trauma and all that. So when they are nicely motivated, definitely they have very good, there is a better influence in having a normal vaginal delivery rather than asking for a cesarean for a factor called pain and unknown tension of delivery. So it is how good the couple is motivated. That's why we have yoga sessions. When we have yoga sessions in house, we usually ask the couple to come over so that they will be trained confidently and everything goes well, even during labor and delivery. There is nothing new that they don't know about. So yoga has definitely a role in, as I have told you, the normal delivery, partner support, the benefits physically, the benefits mentally. When you talk about mental benefits, yes, somebody who is doing good yoga in the morning or any time in the day, they definitely have that confidence. They don't have unnecessary apprehensions because the stress in the body is quite low. And They do not have anything that is not known to them, especially physically, they are fit, mentally, they are well supported, emotionally, they know what to deal with, and everything else is easily managed. So, for people with yoga, definitely it is a state of well being that is there, and yoga definitely helps in the long run. Not only about yoga, we have even followed up our pregnant women through this whole situation where they had good antenatal care with nice vitamin D supplements that we usually give, and diet support, organic food, fresh food, seasonal food, and socially relevant food like what their ancestors used to eat, especially organic food, and also some air purifying plants, and also about general well-being, how to stay away from pollution, how to stay away from junk food, and all these things. And yoga added benefit to all these things, along with the good antenatal care. We have definitely seen very low numbers of COVID positive mothers. I still feel that COVID emotion, COVID attacks people who are physically less in terms of comorbidities, and also emotionally weak people, especially when the confidence levels are low. And definitely when low vitamin levels are low. All these things are well supported to my pregnant woman who follow up with me. So definitely we had very, very low in-house numbers of COVID positive mothers. Even though we had one or two here and there cases, definitely their severity was very less and managed very well. That is really, really a good thing to talk about. And when we had mothers from other hospitals who came for checkups of COVID, and then they had deliveries with us, we even inculcated their post delivery time and also their in-house medical management time with yoga, breathing exercises, and supportive measures. They have also fared very well, and in terms of healing, they quickly healed and they went home very well once they adapted to this form of healing. So medicines also work well when you are physically well, emotionally well, and you have yoga in your daily practices. So even small amount of breathing exercises, it brought lots and lots of changes in terms of improving lung function, especially COVID affected mothers who came here for COVID care and COVID deliveries. They were they were really influenced by the kind of breathing exercises that we gave them, and they all healed very well and very fast. And definitely earlier lung function improvement and discharge online. Very rarely we had cases which deteriorated, and those were specifically people who were very reluctant to do even breathing exercises. So even COVID is definitely lesser in terms of incidence, severity, and recovery, faster recovery for anybody who's on yoga and also on good physical enduring health practices like yoga and exercises. So, including all these things, yoga it causes relaxation, it causes improved breathing, it decreases anxiety, it increases the calmness of your body, and it improves sleep. If I have to talk about sleep, general sleep disturbances are quite common in pregnant women, even in the first trimester and last trimester. Women going through yoga and yoga exercises, antenatal exercises during pregnancy definitely had lesser incidence of sleep disturbances when they were regularly doing yoga and yoga practices because it improves lung function, it improves brain function, it improves relaxation. So definitely your overall well-being is improved and sleep pattern is also very good. Especially when you have sleep disturbances, yoga had definitely role in improving the sleep pattern. When we have to talk about yoga and yoga poses help in pregnancy, that's a very important part of pregnancy yoga. The most efficient 5 poses I can talk about today, and asanas which help in pregnancy are a separate note. when we have to talk about 5 poses that improve functional capacity in pregnant women, they are cat cow pose, in which the pregnant woman leans forward and it's on the upper 4 legs, 2 legs and 2 hands. So this is called cat and cow pose. There is another pose called balancing table pose, wherein one hand and one leg are raised, and a downward facing dog pose, goddess pose, bound angle pose, and butterfly squats. So these are some very important poses that a pregnant woman, irrespective of any trimester, can practice. Especially the cat and cow pose, the balancing table pose, the downward facing dog pose, the goddess pose, the bound angle pose, or the butterfly squats. These are very friendly, back strengthening, pelvic floor strengthening, and also the upper body and lower body strengthening exercises. So these are definitely beneficial in terms of 5 or 6 yoga poses that help all throughout pregnancy. And there are several specific asanas that help all throughout pregnancy. Usually we start from the second trimester and go through third trimester, and post delivery, once they have normal vaginal delivery, couple of weeks of rest and then we restart. So these yoga poses definitely have lots and lots of beneficial effects. So there are some asanas that really benefit in pregnancy. To name a few of them, we have Bhakarasana, the twisted pose where you sit and turn towards one side. The Utkatasana, the chair pose. The Konasana, the angle pose. The Padyakasana, the hams pose with one leg. Hasta Pangutasana, we have the Yastikasana, the stick pose. And the Parvatasana, the mountain pose. The Bhadrasana, the butterfly pose. So we have some specific poses which help pregnant women in the second and third trimesters. So yoga is definitely one of the best methods to practice during pregnancy. Hardly any specific contraindications not to do yoga, but even with contraindications, the breathing exercises can definitely give you improved results. A small note about the water yoga that we regularly do, that is called the yoga. The yoga asanas which are done underwater, specifically when women have these muscle aches, back aches, certain apprehensions, balancing issues, we do underwater yoga wherein the balancing is very good, the muscle ache soreness is very less, the poses can be easily dealt with, and also a lighter feeling of buoyancy that is felt during pregnancy underwater. So, underwater yoga, which is called water yoga or yoga, definitely has a beneficial effect during pregnancy, especially women of low risk category and in terms of risk factors, and then people with higher risk, uh, in terms of preeclampsia or IUGR or any other specific disorders like diabetes, uh, well controlled diabetes, of course, and then obesity. All these people can practice yoga underwater. But these days, in COVID times, there are some restrictions due to swimming pool restrictions. So these classes have not been happening. But yes, once any pandemics are off, you will be back into routine. Then routine exercises can be done. Anybody who has an access to swimming pool on a regular basis in their house or in their community, without a pandemic around, definitely you can practice yoga. And there are very few poses that you can do underwater, which are very clearly available online. Even the partner can support the woman, even underwater. And definitely, they will have a lighter feeling of safety feeling underwater and lot of energy, that energized feeling after the water yoga session. So all these things definitely help having a normal vagina delivery. When it comes to outcomes of pregnancy after all these good classes and then antenatal sessions and all, we have definitely had a tremendous benefit in terms of giving a normal vaginal delivery. It is not about any normal vaginal delivery, it is about a normal vaginal delivery which the couple confidently went through all throughout delivery with happiness, with activities, with dance, labor, yoga, all these things, making it more, more involved with the activities during labor, and also a very happy labor feel. It is definitely important these days that we give pregnant woman a feeling that it is a normal period for a woman to go through pregnancy, childbirth, and childbearing, rather than any period of stress or frustration, or it is a disease kind of thing. It's not like that. When normal physiological changes in the woman happen during pregnancy and childbirth, it is important to define the process in such a way and go through that process in a smooth fashion and very well trained, so that they have that happiness quotient running all throughout pregnancy and childbirth and childbearing. Any apprehension that the pregnant woman feels, definitely that creates roadblocks in pregnancy and heart blocks in the process of heart. So we make sure that pregnant women have lesser hurdles, lesser hiccups, and definitely spend their valuable time in a day on something that will give them currently the needed relaxation and long-term results of a normal vaginal delivery, and further long-term results of a happy body and a happy mind. It is important that pregnant women definitely look over to inculcate pregnancy yoga, the antenatal yoga, or the pregnancy yoga into their pregnancy curriculum on a daily basis. If not daily, at least thrice a week if they can practice yoga. Definitely they have improved outcomes. For anybody with fertility issues, on this International Yoga Day, I want to promote yoga even for infertility, because fertility is in such a way that these days, because of the lack of exercise, lack of physical exercise, lot of emotional trauma, mental stress, people are going through fertility issues. When you have to talk about any uh, physically dealing disease or any problem, you have definitely a stress level attached to it, physical problems attached to it. So yoga definitely relieves you from stress, de-stresses you, not only de-stresses you, it strengthens you, it improves the circulation in your body. People with fertility issues definitely will benefit. And yoga and exercises post delivery also are really important to get you back to form, get your strength back, and to take your daily course on and an additional responsibility of the child in the future to go smoothly with your enhanced body strength and mind strength. So it is important that yoga has definitely influenced, and you should understand that prenatal, postnatal, and preconception, all three phases of woman's life, yoga has definitely influenced into the positive end. That is why we even ask women to come for preconceptional visits to at least start the Surya Namaskars and breathing exercises in terms of the pranayama to improve and enhance the blood circulation and fitness. So it is very important that every individual enters into this system, wherein now internationally yoga has proven beyond doubt that there are enhanced benefits with yoga. Why not tap into the pregnancy and post-pregnancy segment? And pregnancy, definitely there is a need into every woman understanding that yoga is not only about some poses and exercises, it has got a role well beyond that. And when you start trying it and to make it into a habit, at least you have to do for the next 3 or 4 weeks to make it into your daily curriculum and exercise regime. So that is how we even give them the benefit of the next level, practice or getting into the habit of following it regularly. So yoga must be encouraged for every pregnancy and preconceptional woman, and yoga must be encouraged to the postnatal woman so that she also inculcates yoga into her daily regime for her parents. And slowly, this way, if we can involve the mothers, it will slowly impact all the children and the next generation's fitness level. That is why, because of yoga, there is possibility of decreasing the metabolic syndrome, obesity levels, the associated PCOD levels, the associated infertility levels, and also encourage fitness in a very meaningful way. So the next generation women have to be taught about being fit both mentally and physically for the next future of this country. Yoga has proven all these things beyond any doubt internationally. So many people are behind yoga and practicing yoga. Even there are places in outside countries where they have mainstay yoga as their profession. So it means that yoga definitely is giving a lot of help. So it's one of the most beneficial things. So if we have to talk about pandemic, definitely about the COVID pandemic, we have been seriously impacted all the pregnant women throughout this pandemic in the form of yoga classes online, and we have all these practices very well established, and we have seen benefit not only in terms of pregnancy and their outcomes, overall gender family well-being is also taken care of. And we have had good results in terms of inculcating yoga practices in pregnant women in this pandemic. And so on this eve of International Yoga Day, we wanted to share our part of knowledge and experience with yoga and breathing exercises like pranayama, anulom vilom, and bhavani, which have helped prevent respiratory viral infections and diseases since a very long time. Also helped several patients of COVID heal faster, improve their lung function, and getting back to normalcy faster. So there has been extensive research worldwide on yoga and its benefits. It also not only improves bodily functions and capability, has also been proven to help enhance mental capabilities, psychological, social, and emotional well-being as a perfect definition. If there are any questions, we'll take the questions so that we will have. We'll take the questions. If anybody has any questions, they can send to. Okay. So to conclude, yoga definitely is a blessing in today's world of physical and mental challenges. And to follow the very definition of health, yoga is important for all age groups. It is important for all age groups. It's an inexpensive, self-motivating solution for several problems and its prevention. Thank you all. And